Hello, and how are you? Welcome to another series on nursing case studies. And in this particular series, I'm going to focus on the general nursing care case study. If you're new, my name is Winnie Barawa, and this channel looks into lectures, lessons, and expert interviews pertaining to healthcare. If you like our content, don't forget to give us a like, subscribe, and keep sharing our videos. So in the first lesson of this session is about we are introducing, basically understanding what a nursing care case study is, what about it, what are the components, and then we shall go into details and look at the various parts and bits that either as a student or a nurse or someone who is practicing would like to write one. So if you wish to write nursing care case studies, this series is for you. So let's see what is inside for us. The question is first, what is nursing care? Because that's the basic of nursing care case studies. So nursing care refers to range of services which are provided by qualified nurses in different settings, and that is could be in home settings, hospital settings, community settings, whichever environment you are practicing in, and the main agenda is to meet the health needs of a patient or their clients. So in this case, nursing care involves different inputs, could be assessment of the needs of the client, planning of the goals, implementation of these interventions, and then we evaluate the outcome. So this is the backbone of nursing care, the assessment, planning, implementation, and evaluation of the interventions to see how the outcome came about it. So the basic goal of any nursing care includes achievement of health, that is maintenance of health of the client, prevention of illnesses, promotion of recovery, and generally alleviation of suffering among patients or the clients that you are working with. So I needed us to understand this bit first before we go into and evaluate the different bits of the case study. So a nursing care in this case is services that we produce to patients and clients in different settings, be it home, hospital, or community, and it involves different aspects of assessment, planning, implementation, and evaluation of the outcome. And the key goal of the nursing care is to ensure that there's maintenance of health, there is prevention of illness, there's promotion of recovery, and we are able to alleviate any form of suffering that the client could be going through. And so from the care that we provide for our clients, we therefore are able to develop what we call the nursing care case study. So nursing care case study is could be a document, it could be a study that is done, or it could be like a research assessment that is done, which involves a comprehensive examination of a patient's status, which comprises again the aspect of gathering, assessment, and interpretation of data through various medical examinations and tests. So remember, nursing case studies, it's an investigative kind of a study where you want to go through the different stages of your client management or through your client's care. Could be from the stage of admission to when they were subsequently taken care of in the ward until they got discharged, and now they have gone home and you are doing home visits and follow up until when you terminate the care of this client. So the nursing case study in this case, it's a comprehensive exam of our client status, which can compromise the aspect of gathering data, assessing, and even interpreting this data of composition of different exams or tests or management. So in other cases, you can define it as an in-depth examination of a patient case, which involves documenting detailed information about the patient history, diagnosis, treatment, and even reflecting on this nursing care. So even in this nursing care case study, there'll be aspect of reflecting on the nursing care that has been given to the patient. What was the outcome? Was it positive? Or are there some aspects that you wish to improve on? What are the key components that you feel you need to have done better? So coming back again, this will involve a lot of data collection and an analysis, and then the nurse will be able to identify the actual and potential health needs of the patient, then plan interventions and evaluate the outcome. So it takes us back to the key steps of nursing care, as you can see. So there's the bit of data collection, which is part and parcel of an assessment. And then there's planning, that is now part and parcel of the planning stage, and then implementation of these interventions, which we are again going to evaluate these particular outcomes. So a nursing case study has all these different parts, which are literally like part and parcel of the nursing care. And that is the backbone on assessment, planning, implementation, and evaluation part. So I hope you're getting the big backbone of our nursing care case studies by now. So why are we doing nursing care case studies? What is the aim of these nursing care case studies? So one of it is to provide a comprehensive understanding of the patient condition. Remember, this is a client you're going to take through from the day you are able to assess them and you're able to tell the signs and symptoms, manifestation, risk factors, you initiated management, you're able to tell the discharge, like you have gone through detailed comparative management. For example, you'll be needed to do what is the difference between the ideal case and the actual management that was given on the client. And then the other aim of a nursing case study is to help us identify best practices when it comes to nursing management and intervention. Remember, here we are working with a real case. So if you saw that in an ideal, which is like the book literature states that a particular case has to be managed in a certain way, and in this particular case that we are studying, the management was maybe changed a little bit or it was modified, then that creates basis for bringing in more knowledge on how to handle these clients. Then you have the bit of enhancing critical thinking, also in decision making concerning patient care and management. And it highlights clearly the role of nursing in patient care, the best practices, the best responsibility, or what are the key responsibilities when it comes to nursing in taking care of a patient. And then we have evaluation of the effectiveness of nursing care in the patient. And most of this comes more clearly when you're talking about patient outcomes at the evaluation stage. And it serves as a practical reserve. Remember, this is a practical study. Like you are with your client, you assess this client, you intervene on this client, you get to see the outcomes, you decide on follow-ups, home visits, and all that. So it's a practical reserve. It creates a linkage between theory and the practical bit or the practical skills. Then the other part is enhanced critical thinking and problem solving skills. So with the case study, handling a real patient in this case means you'll be faced with different challenges when it comes to patient management, and this stimulate the critical thinking aspect and problem solving skills of the student and also even the nurse. This continues on, talking about practical skills again. Here is bridging the gap between practical skills and theory, which you've already actually explained on it. And then the other bit was on supporting effective communication within the healthcare. So let's not be exclusive, because remember, nursing care is part of the patient management, but there's inputs from other managements like medical management, surgical management. We have inputs from occupational health, physiotherapists, the in-house care, social works. All are people who are bringing in their expertise to promote the care of this patient. So when we do nursing care case studies, we are able to create effective communication within the different teams that work together to promote the well-being of this client. So that's one of the aims. And then it's also used as a teaching strategy to help nurses learn real-life practicals or practical cases. So this is part of also learning and promoting to the knowledge pool. And it also improves patient care through collective knowledge. So here we are looking at knowledge coming in from the different teams. So you have collaborative work here, or collaborative inputs. The doctor comes in, gives their input, the nurses comes in, brings their input. The technical team is also part of the team, and you see that the whole multidisciplinary approach brings together to improve the care of this client. And then promote development of research questions and problems. Remember, as you care for your client, you're able to discover a few things or a few aspects that you wish to research more on. For example, you can have been studying the progress of the client and you discover that at a moment when you thought a certain drug was efficient in managing this client, then you discover it did not work for this client. Now, that comes a point of questioning and a point of problem identification, because as a person who is doing this case study, you may want to harness more and question more or research more pertaining that particular area because you want to improve the care of this client. So it's basically a point of research also. And then it addresses health equity by being able to identify the different determinants of health. How is this coming around? Nursing case study is a very holistic approach. Yes, it's a nursing case study, but you want to also identify the main needs and the main issues that your client is facing. So this basically forces us to be able to identify each and every determinant that contributes to the healthcare aspect of this client. So how does that bridge the health equity? Health equity is looking at fairness. So if you discover that there are certain health determinants that are promoting the development of these illnesses in this particular patient, and they come from a specific population which you may be worried about, which you think should be catered for, then as a person who's done this case study, you can actually recommend. So we'll come to another bit of writing a nursing case study which talks about recommending. So under the recommendation, you can state like the specific needs that you've identified in your client and how you wish this can be tackled based on the different approaches that you have done. So that's how health equity can be catered for. So this basically highlights the main aims as per why nursing case study is a very key part to be done. So this brings us to the first part of our nursing case study session. So like I said, don't forget to follow through. Also, you can like, subscribe, and share. But most of all, we really love feedback. You can give us feedback like which parts do you wish us to tackle on? Are there certain areas you didn't understand, or did you enjoy the sessions? And like that. So thank you, and let's meet in the next session. See you.